This is video podcast 10 from learningradiology.com. This is musculoskeletal imaging differential diagnoses part 2. I'm William Herring from Albert Einstein Medical Center in Philadelphia. These differentials are not intended to be all-inclusive. They're designed as an aid to remembering a few of the most important causes for each of the findings shown. First, a case is shown as an example. Try to guess what the differential is that the case exemplifies. Make use of the pause control on your MP3 player or computer. Then, the title of the differential will be shown on the next slide. Use the pause control again. The next slide will reveal the differential diagnosis itself, and the final slide will reveal the diagnosis of the original case shown. This podcast is designed to be used as either an audio-only or a video-only podcast, or both. Here is your first differential. Pause the player. The differential diagnosis is for Acetabulo Protrusio. There are 5 causes. Pause the player. The 5 causes of Acetabulo Protrusio include Paget's disease, rheumatoid arthritis, osteoarthritis, osteomalacia, and osteoporosis. Here's the next differential diagnosis. Pause the player. The differential diagnosis is for acro-osteolysis. There are 6 causes. Pause the player. The 6 causes listed of acro-osteolysis include a thermal injury, whether from burns or frostbite, scleroderma, hyperparathyroidism, psoriasis, Raynaud's disease, and leprosy. Here's the next differential diagnosis. This is an 8-year-old. Pause the player. The differential diagnosis is for avascular necrosis of bone in general, or the hip in particular. Pause the player. Causes of avascular necrosis include idiopathic Legg-Calvé-Perthes disease for the hip, steroid administration, sickle cell anemia, and arteritis, such as found in collagen vascular diseases, trauma, Gaucher's disease, pancreatitis, and fat embolism. Here's the next differential diagnosis. Pause the player. The differential diagnosis is for hypertrophic osteoarthropathy. There are 5 causes listed. Pause the player. The 5 causes include carcinoma of the lung, mesothelioma, a chronic lung infection such as tuberculosis, chronic liver disease, for example cirrhosis, and ulcerative colitis. Here's the next differential diagnosis. This differential diagnosis depends on the location of the lesion. Pause the player. The differential is for lesions that affect the spine. There are 4 causes listed. Pause the player. The 4 causes of lesions that primarily affect the spine include metastases, osteoblastoma, chordoma, and aneurysmal bone cysts. Here is the next differential diagnosis. It too depends on the location of the lesion. Pause the player. The differential diagnosis is for lesions that affect the pelvis. There are 3 causes listed. Pause the player. 3 lesions that affect the pelvis include chondrosarcoma, plasmacytoma, and chordoma. Here is the next differential diagnosis. Pause the player. The differential diagnosis is for posterior scalloping of the spine. There are 3 causes listed. Pause the player. 3 causes of posterior scalloping of the spine include neurofibromatosis, achondroplasia, and a spinal cord tumor such as an ependymoma. Here is the next differential diagnosis. Pause the player. The differential diagnosis is for anterior scalloping of the spine. There are 3 causes listed. Pause the player. 3 causes of the anterior scalloping of the spine include aortic aneurysms, tuberculosis, and neurofibromatosis. Here is the next differential diagnosis. Pause the player. The differential diagnosis is for Lucent Metaphyseal bands. There are 4 causes listed. Pause the player. 4 causes of Lucent Metaphyseal bands include normal, leukemia, neuroblastoma, and the torch infections of infancy, toxoplasmosis, other, rubella, cytomegalovirus, and herpes. Here is the next differential diagnosis. Pause the player. The differential diagnosis is for dense metaphyseal bands. There are 4 causes listed. Pause the player. Causes of dense metaphyseal bands include normal, lead poisoning, treated leukemia, and healing rickets. Here is the next differential diagnosis. Pause the player. The differential diagnosis is for bone within a bone. There are 3 causes listed. Pause the player. 3 of the many causes of bone within a bone include osteopetrosis, Paget's disease, and prior Thorotrast administration. Here is the next differential diagnosis. Pause the player. The differential diagnosis is for chondrocalcinosis. There are 6 causes listed. Pause the player. 6 of the causes of chondrocalcinosis include pseudogout, gout, osteoarthritis, hyperparathyroidism, hemochromatosis, and Wilson's disease. Here is the next differential diagnosis. Pause the player. The differential diagnosis is for an intramedullary calcification. There are 3 major causes. Pause the player. 3 causes of intramedullary calcification include an enchondroma, a bone infarct, and a chondrosarcoma. Here is the next differential diagnosis. Pause the player. The differential diagnosis is for thinned ribs or ribbon ribs. There are 2 causes listed. Pause the player. 2 of the causes of ribbon ribs include neurofibromatosis and osteogenesis imperfecta. Here is the next differential diagnosis. Pause the player. The diagnosis is for intersutural bones, Wormian bones. There are 5 causes listed. Pause the player. 5 of the causes of Wormian bones include normal, hypothyroidism, Down syndrome, cleidocranial dysostosis, and osteogenesis imperfecta.